All right. Hey, everyone. My name is Kayla St. Eliard with the Agency for Substance Abuse and Prevention, and I'm back with another podcast video for you. So for the month of January, we are going to be discussing birth defects, but specifically NAS. And I have Miss Shelley Birchfield here with me. Miss Shelley, why don't you tell them a little bit about yourself and what you do?
I'm a registered nurse at Regional Medical Center in Anniston. I've been there for almost 25 years. Started out as a nurse in labor and delivery, and then accepted a manager job over our OB department. Stepped down a few years ago and went back to labor and delivery. I've been involved in our NAS program since the beginning to help develop that at the hospital.
Awesome. So you guys, I want to just give a little bit of background on NAS. So NAS is Neonatal Abstinence Syndrome, and it's something that occurs in babies where the mother was either using drugs or there was some sort of complications that were going on. So can you give us just a little bit of what neonatal abstinence syndrome is and the kind of the things that you've dealt with in your field?
Basically, it's just the newborn is going through withdrawal symptoms from a drug that was used during the mom's pregnancy. It can be illegal substance. It can be a prescribed medication that the doctor has given the mom that the mom needs for, a certain type of, disease process that she has. So it can be either or. Mm-hmm. But bottom line, once the baby's delivered, the baby's completely cut off from that medication. Mm-hmm. So they will have the same withdrawal symptoms that the mom have if she tried to quit taking that medication. And so then, our goal is to try to help that baby get through the withdrawal symptoms as best we can.
Oh man, that's really devastating. It's something about babies, and just like I was telling you earlier, when I see babies crying for one, that just breaks my heart, because I'm like, what's wrong with them? What can I do? But knowing that they're kind of going through like those withdrawal symptoms and there's nothing, it's not their fault, that's really heartbreaking. So what are some of the early signs and symptoms that you guys see, like, to be able to diagnose them with NAS?
A lot of times we may know that we kind of expect them to have some withdrawal symptoms just based on the mother's history, especially if she is up front and tells us that she has taken certain medications or certain drugs. We do a urine drug screen on admission, so that helps us kind of be prepared before the baby's born. And then we do a urine drug screen on the baby. So we've got some, data that tells us, yes, they are positive or negative. But then the baby will start exhibiting some signs and symptoms. They have a very distinct cry. It's very high pitched, a lot of excessive crying. They have a lot of shaking. They may start having vomiting, diarrhea, sweat, and their temp may be unstable. It may increase more than what we expect it, to be at that age. They do a lot of excessive yawning, sneezing. So those are the things that we're looking at. We actually have a scoring system. It's a Finnegan scoring system. Lots of hospitals use it. It was actually developed back in the 70s by a doctor who was doing research on babies going through drug withdrawals. And we score them on all of them symptoms. And then once they get to a certain score, and of course we're trying to do non-medical intervention. We try to swaddle the baby to comfort them. We try to keep them in a quieter room with the lights dimmed. We use rocking mechanisms. We have the little mamaroos, or just regular rocking chairs. We try to do things to soothe them before we get to medication. But once their scores keep going up, then we do go to medication for the baby.
Now, scoring, what does that scoring consist of? Is it just certain tests after the urinalysis and things like that?
It's actually just an assessment. The nurses will monitor their temperature. They monitor all the yawning and the sneezing. How often are they doing that? They monitor how long they sleep. Sleeping's a big thing. They usually don't sleep very well. They don't eat very well. So all of them things that we're watching for, we're actually putting a score to it. And then we add all that up, and we watch to see if their scores keep increasing. Once they get to a certain number, then that's when we have to start looking at medications.
Oh man, that's really, it's still so devastating thinking about it. So when you do have to get to the medication portion of it, is what sort of treatment does that involve? Is it just kind of giving them like an antibiotic, or how does that work?
We actually give them morphine, but we have a protocol that tells us where we start at. We start really low based on their score, and then we gradually increase it. So you're trying to give them enough medication to control their symptoms, but not give them too much.
Yeah.
So once we get them to a point that their scores start coming back down, then we kind of keep them at that level. And once we've watched them for about 48 hours, then we'll gradually start decreasing that medication again. But right now, in different hospitals use different medications. Morphine is one of them. Some use methadone, but we chose to use the morphine just because we went to a hospital in East Tennessee who's very successful in treating NAS babies, have a huge neonatal ICU where they take care of all these babies from all over the country, not just in Tennessee.
Oh, wow.
And we felt very comfortable with their protocol, spent all day with them, and brought it back to our pediatricians here in our county, and everybody looked at the protocol, and we decided that was best for us and our community to do. So that's the medication we use.
Yeah. And I just really admire your work, because you're getting out there kind of on the front lines and you're seeing these babies and you're so willing to help. And to me, that's just absolutely amazing. And the world needs people like you. But also it breaks my heart because when these women are pregnant, I just kind of want to just shake them and say, hey, you're hurting your baby. Like, you're putting your baby at risk. And that's just kind of why I really wanted to focus on this topic. Wow. Is because I want to make people aware that your lifestyle will affect your baby's lifestyle. Like, if you continue to do drugs or have a substance misuse disorder while you're pregnant, that is definitely going to affect your baby. And I just wonder, are there long-term effects? Like, once the baby, first of all, so the baby comes, you treat them. How long does that treatment take? And are there any long-term effects to that?
Each baby's different, and depending on which medication or drug the mom is taking. We typically watch our babies for 5 days because there's an average about 3 to 5 days. You may not see symptoms immediately, but as the medication's getting out of the baby's system, they're going to start having worse withdrawal symptoms. So we average about 3 to 5 days that we monitor the baby, and then if their scores are okay at 5 days, then we will discharge them home. That's the immediate things that we see. There are studies, there are a lot of people doing research trying to see what the long-term effect for these babies are. We know that they're probably going to have some behavior problems, some difficulty concentrating when they get to school age. Some of them issues, they may have lower IQ. Marijuana is one of the one of the drugs that a lot of people just think that it's safe to use. We're not going to see the immediate drug withdrawals from marijuana, but you're going to see the effects later once the child gets into school. There really needs to be more tracking and following of these babies just to kind of see what happens when they get in school. But that's the things that the educators need to know about, to watch for these children when they do get in school age.
Yes, you're completely right. So are there any suggestions or any options that you would want to give women that are maybe just finding out that they're pregnant and they're on a substance, of what they could possibly do to go ahead and get help so that, when they do deliver, their baby doesn't have the same complications as them?
Well, one of the problems, it really needs to start before they get pregnant, which sometimes that's hard to do, especially if it's not a planned pregnancy. But once they're pregnant, we need to try to help them. They need to talk to their physician first of all, try to help them get into a program like a methadone clinic, something that is under a doctor's care, because they can't, once you're pregnant, you can't just completely quit taking that medication. Sorry.
No, you're fine.
Because it can cause more harm to the baby if you just completely quit taking it.
Hmm.
So we, if anybody comes to us, saying I've got this problem, we try to direct them to like a methadone clinic or some kind of more controlled, program where we know what amount they're getting. They're hopefully only getting what they need to control their symptoms and their desires, and to go out and do drugs themselves. And then once they deliver, try to get them into a program to get them completely stopped. But once they know they're pregnant, you pretty much have to do the best you can during pregnancy, and then try to get in a program after.
Yes.
Yeah. So, but a lot of times the physicians, will contact us. We try to work with them to try to find what we can. Of course, get a good counselor. Most of these patients that are doing substance abuse, there's something else underlying, that's going on that cause them to want to do the drugs. So we try to get them, in with some counselors. There's lots of places in Birmingham that do rehab and do treatment centers. A lot of them won't take pregnant patients. So, it's very hard to try to get somebody while they're pregnant the help they need until after they've had the baby.
Yeah.
But they can, research and find some of them areas in Birmingham that will help them.
Yeah. So recovery is still possible. And that's one thing that we like to talk about here at ASAP is with our logo, Hope, Hold On Pain Ends, our Hope campaign. We try to encourage people and let them know that recovery, it is possible.
Oh, yes.
And even though you're pregnant and you're going through something, it's still possible for you to get that help. And I'm really hoping that somebody sees this video, maybe they're possibly pregnant or even thinking of getting pregnant,
Yes.
And thinking of getting treatment and help, so that way they can save their life and their baby's life.
Absolutely.
Because I know there are people out there that struggle and they're so ashamed to like say, oh, I'm pregnant, but I'm having a problem with opioids.
Right.
Or I can't stop doing heroin.
Yes.
And it's kind of like a little bit taboo in a sense. And I've actually spoken to a couple of people who have had that problem in the past, and they just said they were so afraid that if they went to their doctor and said anything, that they're afraid that their baby would just be immediately taken away.
Right.
Or that they would be shamed, or the doctor wouldn't want to see them anymore. So I'm glad that you're mentioning that there are outlets, because I want people to get help. I don't want them to struggle with anything. And so I was looking honestly at some other things that were going on, like with birth defects with babies with the neonatal abstinence syndrome. And basically I just kind of want to just give some key points, and it's kind of going to reiterate what you have said, but to make sure that you do get a checkup, check in with your doctor, be very open, find a doctor. I know in my case, I'm not using any substances or anything, but when I find a doctor, I have to make sure that doctor's like on my team, because I hate to say it, but not every doctor is for you. So to make sure that you find a doctor that you can trust, that you can go to, that is so helpful. I personally love the doctor that I go see, because I feel like I can tell him anything.
Yeah.
He actually like checks up, what I'm saying? He doesn't just go in the room and just sit down and be like, okay, 5 minutes later, and then he's done.
Right.
He sits down and says, hey, what's going on with you? Do you want to talk? Is there anything? Do I need to bring anyone else in? He's awesome. And so I encourage everyone to find a doctor like that. And when you do find out that you're pregnant and you are using, to not only get that help, but to make sure that you take the necessary steps, like, still take your vitamins and things like that to help nourish the baby and make sure that you're getting all the nutrients that you need. And I think we're going to go ahead and we're going to show a video real quick of some withdrawal symptoms and some struggles that babies do endure when they are going through the neonatal abstinence syndrome.
Born addicted. It might be hard to swallow, but hospitals are seeing it on a regular basis. It's so common they've given it a clinical name.
Okay, neonatal abstinence syndrome is a medical diagnosis for a newborn who was born drug dependent. In other words, that newborn was exposed to multiple drugs while the fetus was developing.
The number of babies undergoing detox has risen dramatically. Currently, there are 9 babies in this unit being weaned from prescription pain meds.
They get carried a lot, they get held a lot. We never let a baby cry. And despite the fact that they are on their medication to wean, they still cry and they still suffer very much the symptoms of their withdrawal.
The Children's Hospital of Southwest Florida was quick to recognize the problem and create an intervention protocol. It starts in many cases before the babies are born by targeting moms who may be on prescription pain drugs.
If we believe that the mother has a significant exposure to opioids, for example, she's a heroin addict, or she is using drugs illicitly, or she has a clear history of appropriate usage of opioids, but during the entire pregnancy, then that newborn will be observed for a 1-week period in the hospital.
Babies determined to have NAS are scored and treated accordingly.
Which at first is non-pharmacological treatment. We'll keep the baby comfortable, keep the environment subdued, low lighting, low noise levels. If the baby continues to show signs of withdrawal, we treat the baby with opioids.
The withdrawal process takes weeks to months. The education process is ongoing.
If you are taking an addictive type of medication, especially an opiate, that will go to your baby without any question, without any doubt, and they will be born addicted.
So, Miss Shelley, I really want to thank you for coming and being a part of this podcast with us today.
You're welcome.
And I really hope everyone takes your word of advice to go out and just seek that help. And I also just want to remind everyone of our Hope campaign, Hold On, Pain Ends, and that your story isn't over. If you are a woman right now struggling with substance misuse or any issue, please feel free to reach out to us here at ASAP at 256-831-4436, or you can visit our website at asaprev.com. We have resources for you. We don't actually do treatment here, but we have over 13 different facilities that we do partner with to make sure that you get the help that you need. Don't be afraid. Do not feel like it's taboo. Do not feel like you have the world against you. We are all rooting for you, and we just want to remind you of that. So I hope you have a good day, and thank you for watching.
Thank you.
Cool beans.